Most men have no idea that prostate cancer is one of the most common cancers affecting men today. Yet it remains a silent threat that develops quietly over years without obvious warning signs. What's even more concerning is that millions of men unknowingly live with early-stage prostate cancer, dismissing subtle symptoms as normal aging processes. Picture this. By learning just a few key symptoms, you could help yourself or someone you love catch this disease before it becomes life-threatening. Prostate cancer affects 1 in 8 men during their lifetime, making it the second most common cancer in men after skin cancer. What's alarming is that over 34,000 men die from prostate cancer each year in the U.S. alone, yet many of these deaths could be prevented with early detection. The tragedy is that nearly 60% of men ignore early warning signs, attributing them to natural aging or benign prostate conditions until the cancer has already progressed beyond the prostate gland. But here's the crucial fact. Research now shows that many of these symptoms can appear months or even years before a formal diagnosis is made, offering a critical window of opportunity for early detection and treatment. Your prostate, a walnut-sized gland located just below the bladder, plays a vital role in male reproductive health by producing fluid that nourishes and protects sperm. Because of its location surrounding the urethra, even small changes can significantly impact urinary function, which makes recognizing subtle warning signs absolutely essential. In this video, we're going to reveal 8 surprising signs of prostate cancer that you might not expect. Some so common that they're often dismissed as normal aging. And here's the breakthrough insight. According to recent scientific research, recognizing just 3 of these symptoms together could improve the odds of early detection by nearly 75%. Why does such a common disease remain so misunderstood? Why is this knowledge not part of everyday men's health conversations? If you find this information helpful, don't forget to like this video and subscribe to stay informed about health topics that can truly make a difference. Let's get started with the first critical sign. 1. Urinary problems. Prostate cancer has the potential to profoundly disrupt your urinary system through several interconnected mechanisms. The prostate gland surrounds the urethra like a donut, and when cancer develops, it can gradually squeeze or obstruct this vital pathway, creating a cascade of urinary problems that progressively worsen over time. One of the earliest signs is difficulty starting urination, often described as hesitancy or straining to begin the flow. You might find yourself standing at the toilet for longer periods, waiting for the stream to start. When urination finally begins, the flow may be weaker than usual, lacking the force and consistency you once experienced. This weak stream often becomes intermittent, stopping and starting unpredictably during urination. As the condition progresses, you may notice an increased urgency to urinate, feeling like you need to rush to the bathroom immediately when the urge strikes. This urgency is often accompanied by increased frequency, particularly noticeable at night when you find yourself waking up multiple times to urinate, a condition called nocturia. Perhaps most concerning is the feeling of incomplete emptying. Even after urinating, you may feel like your bladder hasn't fully emptied, leading to a persistent sense of discomfort and the need to urinate again shortly after. Some men experience dribbling at the end of urination or even involuntary leakage throughout the day. What makes these urinary changes so dangerous is how gradually they develop and how easily they're attributed to normal aging or benign prostate enlargement. While these conditions can cause similar symptoms, the presence of cancer requires immediate attention. Recognizing these urinary changes as potential warning signs of prostate cancer could make a life-saving difference in catching the disease early when treatment is most effective. 2. Blood in urine or semen. One of the most alarming yet often overlooked signs of prostate cancer is the presence of blood in urine or semen. This symptom, medically known as hematuria when in urine and hematospermia when in semen, can be a critical early warning sign that demands immediate medical attention. Blood in urine may appear as a pink, red, or cola-colored tint, or it might only be visible under microscopic examination during routine testing. Some men notice bright red blood, while others see a brownish discoloration. The bleeding may be intermittent, appearing for a few days and then disappearing, which unfortunately leads many men to dismiss it as a minor issue. Blood in semen is often more shocking when first noticed, as it can appear as bright red streaks or give the semen a rust-colored appearance. This symptom is particularly concerning because healthy semen should never contain visible blood. The bleeding occurs when cancer affects blood vessels within or around the prostate gland, causing them to rupture or leak. What makes this symptom particularly deceptive is that it's often painless. Unlike urinary tract infections or kidney stones that typically cause discomfort, prostate cancer-related bleeding may occur without any associated pain, making it easier to ignore or postpone seeking medical care. The presence of blood in either urine or semen should never be considered normal, regardless of age. While other conditions like infections, kidney stones, or benign prostate conditions can also cause bleeding, the possibility of cancer makes immediate medical evaluation essential. Early detection through prompt medical attention when these symptoms appear can significantly improve treatment outcomes and potentially save lives. 3. Pelvic or hip pain. Prostate cancer can cause a distinctive type of pain that extends far beyond the prostate gland itself, particularly when the disease begins to spread to nearby bones and tissues. This pain often manifests in the pelvic region, hips, and lower back, creating a deep, persistent discomfort that's unlike typical muscle aches or joint pain. The pelvis and hip bones are common sites where prostate cancer spreads, a process called metastasis. When cancer cells migrate to these bones, they can cause significant structural changes, leading to pain that's often described as a deep, gnawing ache. This isn't the sharp, acute pain of an injury, but rather a constant, dull discomfort that seems to emanate from deep within the bones. Many men initially attribute this pain to arthritis, age-related wear and tear, or previous injuries. The pain may start as a mild discomfort that comes and goes, particularly noticeable when sitting for extended periods, getting up from chairs, or climbing stairs. Over time, the pain typically becomes more persistent and intense, sometimes interfering with sleep and daily activities. What makes this pain particularly concerning is its pattern and persistence. Unlike muscle strain or typical joint pain that often improves with rest, movement, or over-the-counter pain medications, cancer-related bone pain tends to be constant and progressively worsens. It may be accompanied by stiffness, particularly in the morning or after periods of inactivity. The location of the pain can provide important clues. Pain concentrated in the pelvis, particularly around the hip bones, sacrum, or lower spine, combined with other prostate symptoms, should raise immediate concern. Some men also experience pain that radiates down the legs or into the groin area. Recognizing this type of persistent pelvic or hip pain as a potential warning sign of advanced prostate cancer is crucial for seeking immediate medical evaluation and potentially life-saving treatment. 4. Erectile dysfunction. Erectile dysfunction, ED, in the context of prostate cancer, represents more than just a sexual health issue. It can be an early warning sign of a serious underlying condition. The prostate gland plays a crucial role in sexual function, and when cancer develops, it can disrupt the delicate network of nerves, blood vessels, and tissues responsible for normal erectile function. Prostate cancer can affect erectile function through several mechanisms. The tumor itself may press against or damage the nerve bundles that control erections, which run along both sides of the prostate gland. Additionally, cancer can interfere with blood flow to the penis, as the disease may affect the vascular system in the pelvic region. What makes cancer-related erectile dysfunction particularly concerning is how it develops. Unlike ED caused by stress, relationship issues, or common medical conditions like diabetes or heart disease, cancer-related erectile dysfunction often appears gradually alongside other symptoms. You might notice that erections become less firm, less frequent, or more difficult to maintain over time. The onset may be subtle at first, perhaps noticing that morning erections are less frequent or that sexual arousal doesn't lead to the same physical response as before. Some men experience a complete inability to achieve erections, while others notice a significant decrease in the quality and duration of erections. This symptom is often overlooked or attributed to aging, stress, or relationship factors. Many men feel embarrassed to discuss erectile dysfunction with their healthcare providers, leading to delayed diagnosis. However, when ED occurs alongside other prostate-related symptoms, like urinary problems or pelvic pain, it becomes a more significant concern. It's important to understand that not all erectile dysfunction indicates cancer, but when it appears suddenly or is accompanied by other warning signs, it deserves immediate medical attention. Early recognition and discussion with a healthcare provider can lead to proper evaluation and potentially early detection of prostate cancer when treatment is most effective. 5. Fatigue and weakness. Prostate cancer can drain the body's energy in ways that extend far beyond normal tiredness, creating a profound and persistent fatigue that doesn't improve with rest or sleep. This isn't the kind of tiredness you feel after a busy day at work or an intense workout. It's a deep, overwhelming exhaustion that seems to permeate every aspect of daily life. Cancer-related fatigue occurs through multiple pathways. The cancer cells themselves consume significant energy and nutrients as they grow and multiply, essentially competing with healthy cells for the body's resources. Additionally, the immune system works overtime trying to fight the cancer, further depleting energy reserves. The body's normal metabolic processes become disrupted, leading to inefficient energy production and utilization. This fatigue often manifests as an inability to complete normal daily activities that were once routine. Simple tasks like climbing stairs, carrying groceries, or even getting dressed can become surprisingly exhausting. You might find yourself needing frequent rest periods throughout the day or feeling completely drained after minimal physical exertion. Mental fatigue often accompanies physical exhaustion, making it difficult to concentrate, remember things, or make decisions. This cognitive cloudiness, sometimes called brain fog, can affect work performance and personal relationships. Sleep disturbances are common, with many men experiencing difficulty falling asleep, staying asleep, or feeling unrefreshed despite adequate sleep time. What makes this fatigue particularly dangerous is how easily it's dismissed or attributed to other factors. Many men assume they're just getting older, working too hard, or dealing with stress. The gradual onset of cancer-related fatigue makes it even more likely to be overlooked as the body slowly adapts to declining energy levels. Unlike normal tiredness, cancer-related fatigue doesn't improve significantly with rest, sleep, or reducing activity. Instead, it tends to persist and gradually worsen over time. Recognizing this persistent, unexplained exhaustion as a potential warning sign of prostate cancer is crucial for seeking timely medical evaluation and potentially life-saving early detection. 6. Unexplained weight loss. Sudden, Unexplained weight loss can be one of the most telling signs that something serious is happening within the body, and prostate cancer is no exception. When cancer develops, it fundamentally alters the body's metabolism and energy utilization, often leading to significant weight loss even when dietary habits haven't changed. Cancer cells are metabolically demanding, requiring substantial amounts of energy and nutrients to fuel their rapid growth and division. This creates a competitive environment within the body, where cancer cells essentially steal resources from healthy tissues and organs. The result is a gradual but noticeable decline in body weight, muscle mass, and overall physical condition. The weight loss associated with prostate cancer often occurs despite maintaining normal eating habits or even eating more than usual. You might notice that clothes feel looser, belts need to be tightened, or others comment on your appearance. This weight loss typically affects both fat and muscle tissue, leading to a gaunt or frail appearance over time. What makes this symptom particularly concerning is its insidious nature. The weight loss usually develops gradually over weeks or months, making it easy to overlook initially. Many men attribute weight loss to increased activity, stress, or intentional dietary changes, delaying recognition of a potential serious underlying cause. Advanced prostate cancer can also cause a condition called cachexia, a complex metabolic syndrome characterized by severe weight loss, muscle wasting, and weakness. This condition goes beyond simple weight loss and represents a significant deterioration in overall health status. The psychological impact of unexplained weight loss shouldn't be underestimated. Many men experience anxiety, depression, or fear when they notice significant weight changes without apparent cause. This emotional stress can further compound the physical effects of the disease. When weight loss occurs alongside other prostate cancer symptoms, like urinary problems, pain, or fatigue, it becomes even more significant. A loss of 10 pounds or more over a short period without intentional dietary changes or increased physical activity warrants immediate medical evaluation. Early recognition of this warning sign could be crucial for detecting prostate cancer in its earlier, more treatable stages. 7. Bone pain and stiffness. One of the most serious and often late-appearing symptoms of prostate cancer is bone pain and stiffness, which typically indicates that the cancer has spread beyond the prostate gland to the skeletal system. Prostate cancer has a particular affinity for bone tissue, making bone metastasis one of the most common complications of advanced disease. The bones most commonly affected include the spine, pelvis, ribs, and long bones of the arms and legs. When prostate cancer cells migrate to these areas, they can cause significant structural changes within the bone tissue, leading to pain that's distinctly different from typical aches and pains associated with aging or arthritis. This bone pain is often described as a deep, constant ache that seems to come from within the bones themselves. Unlike muscle pain or joint discomfort that may come and go, bone pain from cancer metastasis tends to be persistent and gradually worsening. It's often most noticeable at night or during periods of rest, potentially interfering with sleep and overall quality of life. The stiffness associated with bone involvement typically affects mobility and flexibility. You might notice difficulty getting out of bed in the morning, trouble bending or twisting, or increased stiffness after sitting or lying down for extended periods. This stiffness doesn't improve significantly with movement or stretching, unlike typical age-related joint stiffness. What makes bone pain particularly concerning is its progressive nature. Initially, the discomfort might be mild and intermittent, easily dismissed as normal aging or minor injuries. However, as cancer cells continue to affect bone structure, the pain typically becomes more intense and constant. The location of bone pain can provide important diagnostic clues. Pain in the lower back, particularly in the lumbar spine, is extremely common with prostate cancer bone metastasis. Hip pain, rib pain, or discomfort in the arms and legs can also occur, depending on where the cancer has spread. Some men also experience increased fracture risk due to weakened bone structure caused by cancer involvement. Even minor trauma or normal activities might result in unexpected fractures, which can be the first sign that brings attention to underlying bone metastasis. Recognizing persistent bone pain and stiffness, especially when accompanied by other prostate cancer symptoms, is crucial for seeking immediate medical evaluation. While bone involvement typically indicates more advanced disease, early recognition and treatment can still significantly improve quality of life and potentially extend survival. 8. Swelling in legs or feet. Swelling in the legs or feet, medically known as edema, can be an often overlooked sign of advanced prostate cancer that deserves immediate attention. This symptom typically occurs when prostate cancer has spread to lymph nodes in the pelvis, or when the tumor becomes large enough to interfere with normal lymphatic drainage and blood circulation. The lymphatic system plays a crucial role in maintaining fluid balance throughout the body. When prostate cancer spreads to pelvic lymph nodes or grows large enough to compress lymphatic vessels, it can obstruct the normal flow of lymphatic fluid. This obstruction causes fluid to accumulate in tissues, particularly in the lower extremities, where gravity naturally pools excess fluid. The swelling typically begins gradually, often starting as mild puffiness around the ankles that may be more noticeable at the end of the day. Initially, you might notice that socks leave indentations on your legs or that shoes feel tighter than usual. The swelling may be more pronounced on one side initially, particularly if lymph nodes on one side of the pelvis are more severely affected. As the condition progresses, the swelling can extend up the legs, affecting the calves and even the thighs. The skin may feel tight and stretched, and pressing on the swollen area with a finger may leave a temporary indentation, a characteristic called pitting edema. The affected areas might also feel heavy, achy, or uncomfortable, particularly after standing or walking for extended periods. What makes this symptom particularly deceptive is how it can be attributed to other common causes like heart problems, kidney issues, or venous insufficiency. Many men dismiss leg swelling as a sign of aging, poor circulation, or spending too much time on their feet. However, when this swelling occurs in conjunction with other prostate cancer symptoms, it becomes much more significant. The development of leg swelling in the context of prostate cancer often indicates that the disease has advanced beyond the prostate gland itself. While this may sound alarming, recognizing this symptom and seeking prompt medical attention can still lead to effective treatments that manage the disease and improve quality of life. Advanced prostate cancer can also cause swelling due to blood clots, another serious complication. Deep vein thrombosis in the legs can cause sudden, severe swelling accompanied by pain, warmth, and redness. This represents a medical emergency requiring immediate treatment. Understanding the connection between unexplained leg or foot swelling and potential prostate cancer, especially when other symptoms are present, could be crucial for seeking timely medical evaluation and appropriate treatment. Prostate cancer may be common, but its impact is anything but ordinary. What makes it so dangerous is not just the disease itself, but how easily its symptoms can be ignored, dismissed as normal aging, or attributed to benign prostate conditions. Yet, as we've seen, these signs are far from ordinary. They are your body's important warnings, trying to tell you that something significant is happening. By recognizing even a few of these early symptoms, whether it's urinary problems, blood in urine or semen, unexplained fatigue, persistent bone pain, or leg swelling, you may be giving yourself or a loved one a precious advantage. Time. Time to seek help. Time to get proper screening. Time to act when treatment is most effective. The truth is, knowledge saves lives, and sharing that knowledge can save even more. Prostate cancer is highly treatable when caught early, with survival rates near 100% for localized disease. But this depends entirely on recognition, action, and early detection. If this video helped you understand the hidden signs of prostate cancer, imagine how many others could benefit too. So please subscribe to our channel, turn on notifications, and help us continue spreading critical, potentially life-saving health information. Remember, these symptoms don't automatically mean you have cancer, but they do mean you should have a conversation with your healthcare provider. Regular prostate screenings, including PSA blood tests and digital rectal exams, remain the gold standard for early detection. Thank you for watching, and remember, your awareness today could mean someone's survival tomorrow. Don't wait. Don't dismiss. Don't assume it's just aging. Your health is worth the conversation with your doctor.